Hello everyone, Karen here. I'm going to be going over some stretches to help maintain flexibility of the pelvic floor and the pelvis. So if your pelvic floor is really tight, you can have some tension or pain around the pelvis, hip, or low back. This is a great stretching routine that you can do. So first we're going to start off stretching the muscles into the back. So the hamstrings attach into your sit bones. So if your hamstrings are really tight, then that can change the angle of your hips. So you're going to try and bend forward at the waist and reach for your toes. You can hold for anywhere from 15 to 30 seconds. You can back off to reduce some of the tension and repeat that a few times. You can do that as you see, one leg at a time. This is helpful if you have one side that's more tight than the other. That way you're appropriately stretching each side. Or you can do both sides at the same time and gently lean forward. You may need a strap or something to assist to try and get the appropriate pull. So you can use either a resistance strap, or I find that a nice taut rope can be helpful, because then you're not working against the band. So you could have that around your feet and gently lean forward. Another great position that you can do a hamstring stretch in is laying on your back. So you can, one at a time, lift the leg up towards the ceiling. You can even do it dynamically by gently moving out of a knee bent to a knee straight position. Butterfly stretch is another great pelvic floor stretch. So it helps with that outward rotation at the hip. You're going to bring your feet together, bring your knees out to the side. You can apply pressure through your elbows into the inside of your knees and gently rock back and forth. Or gently push down, hold, and come back up. That's great to work on outward rotation. If we want to work on inward rotation, then we can do a windmill or a knee touch. So you can gently rotate the knee down towards the floor. You can hold that position. You can even apply a little bit of extra pressure with your other foot. Or you can slowly rotate in and out. And I would repeat that 10 to 15 times a side, or as you feel like you need. Another great option is bringing the knee over and letting the leg either extend out, or you can keep it bent if you can't handle quite that much stretch. That's another way to stretch out the muscles into the glute and to the hip. Next, you're going to bring your foot across to the other side of your opposite leg. You're going to grab onto your knee and gently pull towards your opposite shoulder. You can hold again for 15 to 30 seconds. And you're going to do that on both sides. And you should be feeling it into the hip and glutes, and it can kind of wrap around into your back. It's important to breathe while you're doing these stretches, so taking a nice deep breath in and letting it out, and you can use the breath to help soften into the stretch a little bit further. Good. Now pigeon is another stretch that I'll often recommend my pelvic health patients do. So from a seated position, you're going to bend this knee, you're going to bring your back leg straight back, trying to keep your hips level in front. depending on your level of flexibility, you can come down towards the mat, or you can bring your head all the way down. Same idea, you can hold that for anywhere from 15 to 30 seconds, or if it's feeling really good, you can hold it a little bit longer. You can repeat 3 to 5 times or as needed, and you'll do the same thing on the opposite side. "90-90" is another great option, especially for men. They might not be as flexible or be able to get into that pigeon position. So I have one leg bent 90 and the back leg bent 90. I can then even sort of windmill between the two sides and make it more of a dynamic mobility. And you'll really feel that into the hips. Okay, the next exercise I like to give my patients using a lacrosse ball or some sort of tennis ball or a nice firm ball. Okay, so you're going to take the ball, you're going to sit on the ball into the glute area. So you've got it in here, you can do in here, or all through the glutes. So again, remember I mentioned that in my previous pelvic floor video on anatomy that your pelvic floor has some hip rotators that make up the posterior part of your pelvic floor. So this is a great way externally to release those muscles. And so I typically will say you can spend 1 to 2 minutes just working through the area and loosening things up. Now the muscles on the front of the thigh also attach to the front of the pelvis. So getting good length through the quads and hip flexors is also important. I like to do more of a dynamic quad and hip flexor stretch by gently moving in and out of that knee bent position. If you prefer more of a static stretch, you can bring your knee back, heel towards your bum, and hold that for 15 to 30 seconds. To isolate more through the hip flexors and less through the quads, you can do in a lunge position a dynamic stretch in and out with your knee bent and touching the ground. Make sure that you keep your abdominals a little bit engaged so that you don't just have an arch through your low back. And you should feel that more through the hip if you keep your hips in a neutral position rather than letting them dump forward. And dynamically, you could hold for 10 seconds and repeat 3 to 5 times or as needed. Okay, I hope you enjoyed this video and continue to follow along with me on my pelvic health series. Thanks so much. Have a great day. Bye.